Call the member for Bowman.
Deputy Chair, thank you for the opportunity to talk about this very, very important illness, particularly for older Australians. Herpes zoster virus is a significant cause of morbidity, particularly for those over the age of 50. Of course, all of us will have had that personal experience with chickenpox in children, and HZV is simply a manifestation of that disease later in life and has significant chronic impacts. Those impacts, of course, I'm very familiar with, having been an eye surgeon treating herpes zoster ophthalmicus, which is an occurrence from this infection that occurs in about 20% of cases, mostly in older Australians. It's been a long time coming, vaccines that are effective in the herpes family, and HZV, of course, is probably the most significant cause of morbidity in older Australians in that family of over 5 different herpes varieties. The HZV is responsible for significant pain and suffering for older Australians, and to understand the economics of the benefits of a vaccine requires that we look at both the age of the person, because age is going to affect not only the incidence but also the severity of the condition, but also the fact that the vaccine itself is less effective as one becomes older. And of course the economics of life expectancy at every age point in time start to also mean that you have different cost benefits from the vaccination. Evidence also isn't complete for use of this vaccine in younger patients. So while it's registered for use in over the age of 50, it was that a very important budget announcement that made it available for 70-year-olds, which I commend. And in addition to that, a catch-up program for those who were recently 70 years of age. So between 70 and 80 now, you can be reasonably confident that over the catch-up period you'll have access to this vaccine. Of course, nothing stops you going out and getting that on the free market, but it is now added to the National Immunisation Program, an important benefit. Of course, we're always going to be looking as well at those under the age of 70. There's quite a lot of evidence around 60 to 70. It becomes weaker, particularly around the efficacy of that vaccine in those aged 50 to 60. What we're talking about, of course, is familiar to everyone. We often recall chickenpox in our youth. We can't always be sure it in fact was chickenpox, but that really doesn't matter. In our lifetime, we'll see about a quarter of Australians having an episode of HZV, making immunisation something worth considering. Those painful vesicular rashes that are very much restricted to what we call the dermatomes, the area of the body that are covered by a nerve, in this case a cranial nerve, really demarcates the area where you can get those rashes. They are very, very conforming to those dermatomes, and of course that small percentage chance that you'll have more than just the pain of the immediate episode is the great concern. It's not the immediate infection that's necessarily the problem. It's a whole series of what we call sequelae that can follow with time. And when we look at the post-herpetic neuralgia, that means pain in that affected area lasting more than 120 days after the initial infection. We consider that to be post-herpetic neuralgia. And that kind of a pain can exist for years, is worse in those who are older, and can be associated also with a range of other outcomes. And they're basically obviously the local scarring and pigmentation of the skin where the rash occurred. There's the ocular involvement that can lead to severe ocular problems, which I'll talk about in a second. But there's even the possibility of meningitis and other systemic infections where large parts of the body are affected. These neurological problems are extremely rare, and they're most commonly seen in people who either are living asymptomatically with HIV, for instance, or someone who's going to have some other kind of treatment that might affect their immune status. And in those cases, you'd on a case-by-case basis want to consider the benefits of vaccination. Right now, of course, we have the program being obviously approved for 70 and above, but I commend the member for Ryan for raising this bigger picture, which is that this is a relatively affordable vaccine, but through more and more detailed cost effectiveness analysis will be considered, I hope, in the future for younger populations. Anyone who's seen a patient who has lived with post-herpetic neuralgia would know that it's really limited in treatment to only a very, very few versions of analgesia to reduce that pain. This can go on for years, and it's something that a vaccination can make a complete difference for. Remembering it's not a complete cover. So we're talking about reducing the incidence of the disease by around 50%, and we're trying to reduce the severity, the duration of that post-herpetic neuralgia if it were to happen. And as we see reductions in that by about 2/3 for those over the age of 70 and slightly less than that for those under. Well worth considering. We'll see further cost-effectivity analysis leading to further approvals, I'm sure.